I'm Dr. Craig Escude, the host of IDD Health Matters, a podcast where we talk about health, wellness, and health equity for people with intellectual and developmental disabilities. Hope you enjoy it. Hello and welcome to this episode of the IDD Health Matters podcast. I have two great guests today, Dr. Rachael Sweeney and Dr. Amy Curtis. Welcome.
Thank you.
So let's just start by, you decide who wants to go first, but tell us what you do in your line of work and how it relates to people with intellectual and developmental disabilities.
So I am the nurse practitioner program coordinator at Auburn University, and I also work as a nurse practitioner in the emergency department in both a pediatric setting as well as adult setting. And so I came to this through some personal reasons, but as a nurse practitioner in the emergency department serving patients with IDD, people are scared of them. Yep. Providers and nurses don't know how to communicate with them or how to talk to them, how to work with them, and how to even get them to cooperate. And so that has driven a passion for me as a nurse practitioner in academia as well, and as a program coordinator, that the importance of this in incorporating this into education for nurses at every level, from bachelor's all the way through doctoral education.
That's excellent. Amy?
Well, I'm Amy Curtis, and I am an associate clinical professor at Auburn University College of Nursing with Rachael. I take nursing students, undergraduate nursing students, in their first semester to the Exceptional Foundation. That is a foundation that caters to our IDD population in the Auburn and Opelika area. What I was finding is that our students didn't know how to talk to this population. As Rachael said, they were scared. They don't know, well, what if they ask me something I don't know? What do I say to them? How do I approach them? What if they don't want me to sit next to them? So just kind of destigmatizing the IDD population has been a passion of mine.
So I've got a question for both of you, and I'll start by hopefully lightening it a little bit by telling you my story. I was scared when I started in this field. I didn't know what to do. I didn't have training. What was your initial experience in nursing school or right out of nursing school? Did you have experience or training in working with people with intellectual and developmental disabilities?
So I never had any formal training dealing with this patient population in nursing school. Mine came more out of an experience I had with my uncle. He had a fall and was sick, and then he ended up in the emergency room. At the time I was in nursing school. It was the end of the semester. I was studying for an exam, and he got sent to the ER because he'd fallen, but he fell because he was sick. And so my experience, that was the first time in healthcare I really had the exposure to healthcare professionals dealing with someone with IDD. And the nursing staff had no idea how to talk with him. He went to a room and was really kind of just ignored, except for when things were needing to be done. He needed a CT scan, and so they said, well, we'll just be right back. And my mother and I said, you're probably not going to get a lot of cooperation from him because he's scared and he doesn't understand. And so after we spoke with them for a while, we convinced them to let me go with him. Luckily, I actually worked for the hospital system, so that probably helped.
That helps a little.
But they allowed me to go with him to a CT scan, and I put on lead, and I was able to explain to him in a way he understood. But that was my first exposure to really seeing that in healthcare we don't train people and we don't teach people how to take care of this population and the stigma that's associated with it. And it's really just taking a little bit of time that a lot of providers, unfortunately, either can't or won't. And so that's where my passion in healthcare started for this.
So many of us come into this field either by accident, where we just kind of fall into it, which is kind of my story. I just fell into working, at a regional center for people with disabilities, and realized very quickly that I didn't have the training or background to do it, or we have a personal story that has really affected us, and that sounds like that had a big impact on your life and why you do what you do now, right? Yeah. Amy?
Well, mine was a little bit different, not necessarily family related, but in high school, growing up, I had friends that had disabilities, visual impairments, physical impairments, and hidden disabilities as well. So I really helped tutor and train a lot of my classmates, growing up in the school system. And then when I got to Auburn to teach, the students I was taking them to clinical, and we were going to the hospital at that time, and we had a patient with autism, and one of my students said, "Dr. Curtis, I can't go in that room. I don't know. I'm scared. What if they're violent? What if they're..." So I was thinking back to my training. There's no training. We do not train healthcare. We do not train nurses, physicians. There's a huge gap in the literature because there's no formal education. And so I started going to our centers in the Auburn and Opelika area to help them and training their volunteers and parents and caregivers, and realized we have such a gap in the knowledge that's out there, and we don't properly train healthcare or anybody actually how to work with individuals with developmental disabilities.
So you guys identified that there was a gap, and now you're doing something about it. So what are you doing to address this?
So we started with our graduate education and our nurse practitioner students, and we partnered with Inelectability, and we're using the curriculum to really show our nurse practitioner students and introduce them to this topic and this foci of care that they otherwise don't get. And so we incorporated it about 3 years ago. So we've had several iterations of it now, and we originally had it in our population-specific courses, and the feedback from the students was, "This is great, but we'd like to have it sooner because we've been through 2 semesters of work, of clinical work, and now we've maybe encountered these patients, but we didn't really understand how to assess them." And so we've moved it back to their health assessment course, and now all of our master's level students are receiving the education, including our nurse educators who go on to work in hospital settings, and they're working with other clinicians and working on the floors and even still taking care of patients at the bedside, so now they can incorporate that knowledge. And then a year after we incorporated it, we worked to secure funding to support more curriculum development and incorporate this across the spectrum of our curriculum at Auburn. And so that's where I started partnering with Dr. Curtis, and now bringing it to the bachelor's level, and we'll incorporate it all through our doctoral programs as well.
That's fantastic. I mean, first of all, I love the partnership that we have together, but just that you see the need and you're making it happen, and that is so important and so valuable. What kind of feedback are you getting from the students? You talked a little bit about some of it, but what other feedback are you getting from the students?
So as a part of the curriculum, I share the story about my Uncle Brian, and how he ended up going from a group care facility where he had thrived for many years to having an unfortunate could have been sentinel event, and then was in care facilities and long-term care for the remainder of his life until he passed. And so I share the story of him because I want people to know that it was preventable. It was preventable through communication. It was preventable through things that could have been done leading up to a fall, including making sure he had the right shoes, making sure his shoes fit correctly, making sure that he had the devices that he needed. And so I share that story and what Brian meant to our family and still does mean today. And in sharing that story, I've had students come back to me and share stories about their family members or about a close friend or someone that they've seen, and also had students come back and say, "Your story inspired me to want to do something different." And it's great that my story can inspire them to want to do something different, but it's about all of the people that are like my Uncle Brian who can't have a voice for themselves, and so being that voice. And the reality is that the students are coming back and saying, "This is valuable information. I've never had anything like this before," and they appreciate it because it gives them a different perspective on how to speak to patients, even patients with autism who are potentially verbal but don't have the communication skills to always say exactly what is wrong or what they're feeling. And so it's been really, really positive feedback.
That's wonderful, and I think it's so important that we recognize that people communicate in many different ways. And it really is on us as healthcare providers to communicate in the best way for whoever we're supporting, or whoever we're providing healthcare for. And I think part of that is knowing the language that's used, and many times it's behavioral language, so we see changes in behaviors that are really communicating something, and it's usually communicating something that's treatable or fixable, or the person is in pain, or they're suffering from something. And we as healthcare providers, I think, need that training to be able to recognize those things, and that's one of the things that I think is so important and valuable.
Absolutely. Yeah. And, I think we have this stigma in healthcare, especially with my students who come back and say, Dr. Curtis, I was in the ER this past weekend doing a clinical rotation, and I couldn't express to you my concern or my frustration because we had a patient who had IDD come in, and the physicians, the healthcare workers, all they wanted to do was sedate and restrain because they did not know how to adequately use their resources, whether that's a caregiver or the nonverbal communication, because like you said, they communicate in different ways, and the onus is on us to help understand them and provide them the care that we would provide to anybody, and breaking that stigma.
We're going to talk about something that I think is really cool and really interesting. It's about Gwen. So, Dr. Curtis, will you tell us who Gwen is and what you're doing with Gwen?
Yes, we received funding, as we mentioned in the previous podcast, to help do some IDD training with our nursing students and teach them across the curriculum.
This is at Auburn, right?
This is at Auburn University College of Nursing. And part of the funding that we received, we purchased Gwen, which is a mannequin, a simulator. It's through LifeCast that she's 7 years old, and she actually has Down syndrome. And we're going to be using that with our nursing students in our simulation lab to teach them how to treat, diagnose, communicate with Gwen, with someone with Down syndrome. And I'll let Dr. Sweeney talk specifically about some of the features that she has.
Yeah, I definitely want to hear about that because we know there are a lot of simulation mannequins being used to train medical and nursing students and other students out now, but I didn't know about Gwen. So tell us more about Gwen and what makes her unique.
So Gwen is the world's first mannequin to ever be made of a patient living with IDD.
Wow.
And as Dr. Curtis said, she's a little girl with Down syndrome. She's modeled after a real little girl that was 7 years old with Down syndrome. And so she's anatomically correct to a patient with Down. So she has a palmar crease. She has a smaller oropharynx. She has all of the features of a patient with Down. So she's got the almond eyes. And Gwen is able to there's a specific monitor that goes with her. But with Gwen, she has the low muscle tone. She has the shorter stature. And so it's really very lifelike. And LifeCast, if you've never seen some of their mannequins, they look like a real
Pretty
human
incredible,
being.
huh?
They are incredible. And so, students will walk in and they will see Gwen in the bed, and you could truly be fooled that it's not a real person laying there.
So how does this scenario work as far as the whole simulation? So do you give a story about what maybe symptoms she's experiencing or whatever? Kind of talk us through that.
So it will look a little bit different at the graduate versus undergraduate levels, and we're still working through and developing and implementing these simulations. But for each one, they'll have a story. So the nurse practitioner students it may be more tailored around an office visit because we're a family nurse practitioner program, where the undergraduate students would be more of an inpatient, maybe on the pediatric unit in a hospital. And we would incorporate standardized patients, which are people who we've trained and they're actors that come in, and that would be the caregiver. And so the students would have to work through scenarios surrounding Gwen, whether in the inpatient or outpatient setting, with the complaint and working through the challenges that may be presented with the IDD diagnosis on top of whatever the case may be, whether it's that she's got a cold, she's got a sore throat. In the inpatient setting, it could be more that she's there for abdominal pain and working through those situations. And so it's really going to be multifaceted and leads into our next goal, and part of the funding that we received is to incorporate clinical education and being in those clinics that Dr. Curtis talked about previously for all of our graduate students as well as undergraduate students.
That's pretty cool, and I bet it's pretty unique. Are there other places using this model?
From what we've seen and what we've, when we wrote the grant that we were awarded, which was an internal funding from the university for mission enhancement funds. And so when I wrote that, looking through the southeastern United States specifically, nothing really came up. Some schools are incorporating things here and there, but they don't have dedicated simulation or dedicated requirements for students across the curriculum to attend or go to clinicals or be involved in settings such as the Exceptional Foundation and some of the others that we're working with in Auburn.
That's a fantastic thing that you guys are doing. I mean, there's no doubt about it, and definitely something hint for other organizations, universities out there, other schools and training programs to take a look at. Yeah. Definitely.
And we part of what, when I wrote this and was in researching in order to apply for the funding, there were two universities that I looked at, and they actually had a HRSA grant several years ago that was specific to patients with IDD and improving care for them. And so some of what we've done is looking at what they had written and what they had worked with to assess patient or students' knowledge regarding these patient populations. Unfortunately, because when the funding goes away, and if there's not push for this, and it's hard to find additional information how this is being incorporated into curriculums. And so the other two universities that I was able to find, their information was great, but it was several years old as well. And so that posed some challenges, but also some opportunities for us to kind of plow through and say, hey, we can set this up and be a model hopefully for other schools of nursing to do similar.
So let me ask you a question. Why do you think it's important to train healthcare providers in general about how to provide good healthcare for people with intellectual and developmental disabilities?
At the very root of it, they're people just like you and I.
Love it.
And they deserve to have the same care that you or I could get in the emergency department or a primary care doctor's office. Just because they look different, they speak different, they might smell different, they have strange movements when they're sitting there, it doesn't take away from that they are a person. And they want to be loved and cared for just like you or I do. Their families want them to be cared for just like you or I would want our mother, daughter, sister, child to be cared for. And when they get that care, it's amazing what comes out of it. It's amazing to see this population's resiliency. And all of a sudden, they open up and become somebody that a healthcare provider may not have otherwise seen, and they can seem very scary at times when you first come into contact with them because maybe they're crying or they're yelling or they're making a loud noise. But if you can get around that and to the root of it, they can leave your office or your care with a smile and just a completely different person. And it's just humanity.
Yeah, I love that. You have anything to share on that?
Well, I was just saying that we would like to improve care, patient outcomes for the IDD population in general. We want to do this not through just nursing, but interdisciplinary, because everybody will encounter someone with a disability, whether it's physical, emotional, hidden, any of the things. So we want to make sure that we are working with in tandem, because that we're not in silos. So we need to make sure that everybody is trained, everybody feels comfortable, because it's not if they're going to encounter someone with IDD, it's when. Yep. So we want to make sure that we are partnering and doing our interdisciplinary collaboration as well.
I'm curious about your thoughts on this. I also think that when the training in how to provide good care to people with intellectual and developmental disabilities is very applicable to a much larger group of people. So as a way of my background, I've spent the majority of my career as a medical director of a large program for people with IDD, but I also worked at a state facility that had a large nursing home population. And so these were people who were older, who had maybe had dementia, that couldn't use words to communicate. And guess what? There are a lot of similarities in some of the things we saw. We talk about the fatal five. Constipation was much more prevalent. Aspiration, seizures can be associated with dementia. All of these conditions, and again, people weren't able to communicate as well because they had trouble with dementia. And many of these things that we learn when we're providing healthcare for people with IDD, to me, are very applicable in other groups as well too. Is that your experience as well?
100%. One of the organizations that we're working with where I take students is a day program, and it's for ages 18 and older. We have a gentleman that's in his 70s that's there. And we want to make sure, because a lot of times when they age out of the system, there are no resources for this population, and you have to think about respite for the caregivers. They still need to be able to go buy groceries, pay the bills, just have a break in general. So we care for this population to allow that to happen. And some of my students, they are very surprised because they just think, well, I went to school with somebody who had IDD, and we had all of these resources for them. I didn't think about once school ended, what are they going to do? Yeah,
there's a big cliff when you hit 18. It's including in healthcare, because pediatricians oftentimes have some training and experience in taking care of children with intellectual and developmental disabilities. But when those children become adults, that's where we have even a bigger or harder time finding adult healthcare providers who have this background and this training and understanding. So again, thank you for doing all of these things. Now, I would guess there might be a few people who are listening that would maybe have some questions or want to know more about Gwen, the mannequin that you use in the program that you have there. Is there a way that they can reach out and find more information about what you guys are doing at Auburn?
Sure. They can go to the Auburn University College of Nursing website. So it's www.auburn.edu/nursing. And then they can go to the faculty homepage and they can look up Dr. Rachael Sweeney or myself, Dr. Amy Curtis, and we would be happy to share some information.
I'm Dr. Craig Escude, President of Intellectability. State developmental disability agencies, managed care organizations, and providers across the United States use Intellectability's health risk screening tool, e-learn courses, and person-centered training to improve health equity for people with IDD. Visit replacingrisks.com to learn more about how you can employ these tools with people you support. Now, we're at the part of the program where I usually ask for, I call it 3 and 3, three things in 3 minutes or so. Tips, words of wisdom, things you've learned along the way that you'd like to share with others that you think can help improve the world of supports and services or health and wellness for people with intellectual and developmental disabilities. So I'll let you decide if you want to come up with 3 between the two of you, or if you each want 3. So.
Well, I think that I would say meet people where they are. Be kind. You don't know the story that they have before they've come to you. Meet them where they are. Be kind.
I love that, and that is so important, especially the part that you said you don't know the story that someone's experienced before, what's gone on. And when we talk about understanding the trauma that other people have been through, we call it trauma-informed care. When we recognize challenges that people may have had in life, that can help us to provide a better support and better health care for people, for sure.
And I was trying to think of an adjective earlier today during the conference. One of the speakers was going around and saying, what is your adjective? You could leave, a lasting impression on the world just in an adjective, what would it be? And I thought of mine long and hard, and it would be impactful. Make an impact.
Yeah.
Just by smiling at someone, you can change their day. Because again, you don't know their story that they bring with them, what they could have encountered and faced that day. So make a lasting impact.
Love that.
So I would say kindness and caring, but it's, this is something that we can teach down to the youngest children. When my uncle ultimately passed, one daughter was 7 and my other daughter was just 4 months old. And my 7-year-old looked at me and she said, "But Mommy, how will Brianna know about banjo?" Which was my uncle's nickname.
Yeah.
And I said, "Well, you're going to tell her and you're going to teach her." And so he continues to be a part of conversation and our daily lives in our family. And he impacted far more than just myself and my kids. I mean, we have a large extended family, and everybody just adored him. And so I would say it's sharing the stories, and it's making these patients who may have a disability, they're just people, and it's incorporating them into every aspect of your daily life. And it's sharing the stories, but it's compassion and understanding, and it's advocacy and giving these patients a voice when they can't otherwise speak for themselves, and to be fearless about doing so, because they deserve the same that any, quote, normal person deserves.
You talked about banjo's impact, not just among your family, but he is impacting every student that you're teaching now. From the story that you're telling him and what it inspired in you. So, we always judge, tend to judge other people's quality of life by our standards, or impact in life or value in life by our own standards. But we don't often recognize the incredible value that every single one of us has. And banjo has a lot of value to a lot of people, for sure.
He was the skee ball champion at an amusement park in Salt Lake City. He played basketball in the Special Olympics and won medals for that. And if I can share his story to make somebody else's life better that's living with IDD, and if I can, as an educator, inspire my students to really go beyond maybe their comfort zone, because it can be uncomfortable to care for these patients when you don't have all of the skills or the knowledge, but relying on those caregivers as your means of communication. And if I can inspire through my story and what banjo has meant to our family, to get our future healthcare providers to have a better understanding of taking care of the IDD population, then I feel like I've done my job.
I love it. Love it. So any other tips or words of wisdom?
Just get out there, treat everybody just like they were, your own family member. Care for everybody, no matter what they present with. They're not just a diagnosis. They are a person. That could be your mom, dad, brother, sister, grandmother. So treat them with that care and compassion. And remember your why when you went into nursing.
Great tips, great words of wisdom. You mentioned earlier about the conference, and I just want to let everybody know that we're coming to you from the Developmental Disabilities Nurses Association conference here in Baltimore. And it's a fantastic organization to be a part of. If you want to learn more about providing health care for people with intellectual and developmental disabilities, if you want to become certified by the organization to do that, I highly recommend you look up ddna.org. So thank you both so much for joining me today and sharing your stories. And more importantly, thank you for the incredible work that you're doing in this field.
Thank you for the opportunity to be here and what you're doing with the IDD population.
You're very kind. Thank you. The IDD Health Matters podcast is a production of Intellectability. Learn more about our health risk reduction tools and training for supporters of people with IDD by visiting replacingrisk.com.